So in this conference or the seminar which is going to be there in January, I'm going to talk primarily about psychiatric cases. Now what I'm going to talk is not what we have already, usually what we see. I'm going to talk about my 35 years of experience in this field. So what has happened is I've studied all my cases in this last 35 years and I've found out some sort of pattern. Let's say in a panic disorder, what sort of cases come, in social phobia, what comes, obsessive compulsive, what comes, schizophrenia, what comes, depression, what comes. If you ask me, most of the patients who come to us do come with anxiety, do come with depression. Many of them have some fears, many have obsessions. Few times you might get some bipolar or schizophrenia. But how to see a psychiatric case? What is relevant? Most of us, what happens is when we get a case which is a psychiatric case, we get scared. Oh, this is something which I can't do. There's a lot of diffidence. We even start feeling whether it is even treatable. But I can assure you that the results are excellent. And each of these disorders, in my short time, whatever is there, I'm going to show you maybe a small case. I'll also show you how I take those cases, what is relevant, what is not relevant, what is the psychodynamic. People don't know. If they see a case of schizophrenia, what is exactly schizophrenia? What should we take? Whether delusions are important, hallucinations are important. Is it all pathology? How to give medicines? Many of these patients are already on medications, then how do we stop those medications? Many of these clinical points also I'm going to cover. I have been with the sensation method since the onset of this method, and I also have some more additional things which I can do. I can teach how we can see plants, like how we see minerals, we have a periodic table. Similarly, we can talk about plants with a system. I also have this whole approach of looking at the patients from an evolution point of view. So I will also be giving you all some ideas about all this. I believe this will really help you go one step ahead in your clinical practice.